Okay, we are good. Well, everybody, sorry for the technical difficulties. We worked it out. And what an apropos topic we're going to talk about tonight, the brain-gut axis. My gut is just jumping up a little down a little bit there. So I am so excited to speak with my colleague and friend, Dr. Wanda Bedinghaus. Dr. B, welcome to tonight. How are you today?
Thank you. I'm fine. After a few glitches, we're good.
A few glitches, right? But we work through it. We'll breathe in through our nose. We'll let it out. That's pretty wild, right?
Yeah.
All right. So welcome everybody who's watching tonight. Tonight, I'm really excited because we get to talk about the topics I love, the brain, the gut, the immune, this wonderful, wonderful axis. So you like to go by Dr. B, correct?
Yeah, that's good. It's fine.
All right. So I want to hear your story, right? So you are a medical doctor, right? You were in conventional medicine, as one would say. And now you mix your conventional medicine with your functional medicine, and you've really taken it to another height. So tell me, when was the decision? You went to medical college, you got your medical degree, but somewhere along the line, you said, hey, there's something more that I want to give. There's something different that I want to do than the traditional conventional medicine. So if you can start with there, that'll be great.
Okay, it's a long story. I'll make it short, okay? I started out in pediatrics. I had a practice in Plano, Texas for 14 years, traditional peds. And somewhere along the way, I realized that what was happening, what I was doing wasn't really helping, okay? I got totally disenchanted with medicine. I actually went to seminary and became a minister. And I had a couple of churches over about a 6-year period. And then I just felt called back to medicine. I've always loved medicine. I also like the spiritual part of life, but also I love medicine. So I actually studied homeopathy and practiced homeopathy for about 10 years. And then that was hard. It's hard to explain it to people. And, people want facts and figures and labs and things like that. And I said, well, I need to find a different way to practice. And so I read Mark Hyman's book. Many people got started there. And I thought, this makes sense, You can really do something to help people in very simplistic ways. So I started, the first module I took in the Institute of Functional Medicine was on GI health, because it seemed like so many patients that I was seeing had problems with their gut. So that's how I started. And I gradually started moving more into functional medicine and kind of gradually moving out of homeopathy. And one of the big challenges that I had was I'm used to little kids, and all of a sudden I got big people. How do you deal with these big people? You can examine a 2-year-old, almost in one fell swoop. But anyway, I got used to it, and I gradually took through all the advanced modules. And a couple of years ago, I took the test and got certified in functional medicine. And what I found, Michael, is so many of the patients that I see have gut issues. Okay. Now we do other things here too. We also do brain health, and we also do body health, manual therapy and craniosacral therapy. And together, I feel like we have a pretty good, well-rounded practice to help a lot of people. So that's my long story short.
That's a great story. It must have been interesting coming from that homeopathic background, because I had the opportunity to work with a homeopathic physician who was classically trained in India. And I found the way that he actually, examined a patient so completely different from our conventional teaching.
Yep.
So, we want to know, where's the problem? What makes it worse? What makes it better? And he was like, do you crave salt? Are you hot? Are you cold? And it was like all this biological body system like questions, not just like, where's it hurt and how we make it better. And I found, working with him absolutely interesting. I already talk about Mark Hyman. So still in my bookcase is his Ultra Metabolism book, and I remember reading it, and same thing, like, this makes absolutely incredible sense, right? This is how we should be rolling all the time, not just a pill for every ill, but also just not a vitamin and a supplement for everything you feel as well too. So, I'm a big fan of his. So let's talk about the gut. And we have so many people that come into my practice. I know they come in your practice and they have a tremendous amount of gut pain. In your practice, do you see more of one type of gut pain versus another type of gut pain?
It's kind of between excessive bloating and reflux. I actually see more people who are bloated, okay? Gas, they may be constipated or they may have diarrhea. Uh, some with GERD, reflux and heartburn, but not quite as many. Now, sometimes they have everything gut wise. And then, of course, all the other symptoms that go with a disordered gut.
Well, let's talk about those other symptoms, right? Because I don't think a lot of folks, they recognize that, what, maybe that, skin issue that they have, like the eczema could be related to the gut. They don't recognize that brain fog, the way they feel in their head is related to the gut. And, people just think you're just eating food, right? So let's
Mm.
talk about a little bit, if you can, on how something in the gut, as we say, what goes on happens on the inside can be seen on the outside, how a gut problem can cause a dermatological, a skin issue.
Okay, well, if there's disorder in the gut, many times there's inflammation, okay? And of course that's related so many much to their diet and stress, okay? So everybody's, when I first was in even when I was still in pediatric practice, I would have a few patients come in and say, I think my kid has leaky gut. And I'm like, what? I don't know what that is. So over the years, now we know that leaky gut is a real thing, which means that inflammation has caused the tight junctures in the cells lining the GI tract to open up a little bit. And when they do, you've lost your protective border. So foreign substances can get through and get into the bloodstream and cause inflammation in the body. And also because the gut and the brain are so connected, that inflammation also can get to the brain and cause what we now understand is leaky brain, okay? Because the cells lining the blood vessels there also should be tight, but if they start opening up, then those inflammatory molecules can get in there and make the brain inflamed. Okay. So, there's so much more to that than we could possibly get into, but
Sure.
many of the patients that I see have brain fog and they have gut issues. So the first thing we do is try to address their gut issue. Sometimes we will actually well, I won't get into that right now, but there's a definite connection and also a definite connection to autoimmune disease. I see a lot of people, especially young women with Hashimoto's thyroiditis, and nobody ever checks it. But I do a full thyroid panel on almost every new patient I see. And it's amazing how many of them have some thyroid dysfunction that they didn't know about. So, that's what functional medicine is. It's a puzzle, and our job is to keep finding the missing pieces. And, I think Mark Hyman says it's functional medicine is the medicine of why.
Right.
The same thing with homeopathy, actually.
Right.
Okay, why? Why is this vital energy distuned? And I learned how to take case history in a way that I'd never learned in traditional medicine through homeopathy. And I still take my case somewhat like that.
Mhm.
You got to really let the person tell you their story and understand all the things that have impacted their life all the way pre-conception. Okay.
And I think that health history, what I like to call, their health journey,
Yeah.
is really, really important. And following that same line, when you talk about where they've been and who they have seen in our area, and I think it's more so not because of the docs so much, but because of insurance. When it comes to the thyroid, they check TSH, maybe T3, T4, and that's it. It's just a TSH with reflex. And if something shows up, oh well, then it'll reflex to the others, and that's it. And sometimes they miss, the whole picture. So, it's interesting as functional medicine docs, we want to go deeper, right? It's just not that first marker, second marker, it's the whole person.
That's
Now
right.
you talked about the whole brain issues. So my question to you is, do you feel there's a relationship between a leaky gut or a leaky brain? And we see that in the neurodegenerative folks. So we see that in MS, we see that in Parkinson's, you'll see it in ALS. Do you find that in your practice? Do you see where there is that relationship?
I think so. I have to think about that for a minute exactly. We do EEG here, okay? We do 19 channel digital EEGs, and then we can create a brain map that tells us where uh, the problems are. And we also can convert it into what is called a Loretta scan. And you can actually see different parts of the brain light up. And then you hover over it, and it tells you what Brodmann area is involved. And it begins to open up the picture. And one of the things we discovered uh, as we were doing this is that the insula, which is part of the brain up in towards the frontal lobe, is frequently inflamed, and those people frequently have GI issues. So when we're doing neurotherapy, we also treat the gut. Okay, we use pulse electromagnetic frequency and direct alternating current. Okay, so we treat the dysfunction in the brain, but also the gut. And without doing the gut, the brain can't get better.
Right. So you threw a lot out there. So we're going to roll it back a little bit, and let's start just with brain mapping, right? So you said, well, we just do a brain map, and then we hit these areas. So if you can explain to everybody, what brain mapping is, because around here there's not a lot of brain mapping, and I don't think around your areas there are a lot of people doing brain mapping.
Probably more than you realize. Okay. This is all once you do the raw EEG and you gather all the squigglies, on the
Mhm.
different placements, then that raw data is converted into a brain map. Okay. You literally get a picture of the brain, and you go through all the different waveforms, the slow wave of delta and theta, alpha, beta, and high beta, and you look to see, is there a deficiency of energy or an excess of energy in that area? And that helps us create a protocol to stimulate the brain for the neural pathway, the networks to communicate with one another better. Okay. It's, if I had thought about this, I could show one, but I don't think I have that up on my computer right now.
But
Maybe it's
you're
under.
able to see, like when somebody has a brain issue, you're able to look at that and then clinically associate that with a presentation, correct?
Yes,
So
yes.
if we're talking about the gut and when somebody comes in with, let's say, an IBS, what would you see in the brain?
Well, it depends. Okay, uh, maybe nothing. They may not be really be having brain issues. They may not have very much brain fog. But I have never done an EEG since we've been doing this for 12 years that was absolutely normal. Okay,
Mhm.
because all of us have had a little bang to the head,
Or
maybe birth trauma, anoxia, lack of oxygen during the birth process. Um, those are the biggies. Okay, yeah, I don't want. I feel like I'm confusing people, so I don't want to get too technical about it. But a lot of a lot of the kids that come in to see us who are having difficulty in school, okay, and maybe they've been diagnosed with ADD, ADHD, which is basically the same thing. Um, we do an EEG, but if we don't treat the rest of them, it's hard to get the neural therapy and the neurofeedback to be as effective. Okay, so many of the kids I see come in, they have gut issues. Okay, nobody knows it until I ask.
right.
So
I think a lot of people just take it for granted, right? Of course you get of course you get a little reflux, of course you get indigestion, it's just of course, and it doesn't mean of course, just because it happens all the time doesn't mean it's normal.
that's right, and so that's why if we get a call for somebody who wants to do our neural therapy, they see me first. We don't just jump in there because, it's you're treating one part of the body without a whole picture. And that's the whole thing about functional medicine. we're trying to get as whole of a picture as we can so that we're looking at all of the biological systems in a coordinated way.
So if you can walk us through when a patient comes to your office, because you offer craniosacral, you offer, so we're going to talk about that. You offer the manual work, you offer PEMF, you have the neurofeedback, we do the brain mapping, there's gut stuff. I mean, when somebody walks in, I mean, you're only one person, you're a superstar as well. How do you determine, like, someone's going in this road, someone's going to go down this road? What do you do? What are you looking for that makes your decision?
Well, it's based on the history, okay? If they don't have any, let's just say they have gut issues, okay? And I've already started them on an elimination diet, and they started it before they even saw me, and they're better. And then I'll do some more functional medicine type tests, and that may be all we need to do, follow up with them. They come in, they have gut issues, but they also have a history of multiple traumatic brain injuries. They've been in car accidents, they've been skiing and fallen and had a concussion. So from there, after we get the basic information, I will probably say, I think we should do an EEG, look at your brain, okay? We look at the brain, we see, hey, we got some big problems here. We're going to work on that. Well, at the same time, they're doing the functional medicine type things that I've recommended. If they've had a lot of head trauma, then Dr. Sloss is our manual therapist, who is also trained in craniosacral. And we found that if they've had significant head trauma, that it works better with our therapy if Joan does an evaluation and does some craniosacral work, because the cranial bones can be out of balance. And if we don't balance that, then our neural therapy is not going to be as effective. Okay. So the patients that come in here, most of them see all three of us, well coordinated. And then, yeah, the other thing that John does is visceral manipulation. Okay. She studied with I think it's Brunel or something like that. So she might see the patient who has chronic constipation.
Mm-hmm.
Okay. And has done a lot of work with that.
All right, we need more people who do more visceral manipulation where I'm at. There's not many that do that. So having somebody on staff that does that is absolutely phenomenal. It definitely plays a role, given the dysfunction that happens in the gut, especially with the fascial structures. I mean, you're very lucky to have somebody that can do that kind of work. So you brought up craniosacral, and you talked about the gut and the brain. I want to touch base on the concussion folks. We have the TBIs, the traumatic brain injuries. I ask my patients who've been involved in motor vehicle accidents, I ask them about changes in their gut since the motor vehicle accident. And they look at me and they say, nobody ever asked me that. And yes, right? So if we can talk a little bit about your approach when you're looking at those, the TBIs and gut issues, what do you see? Do you treat anything differently with that?
Yes, I mean, it depends. Okay, we don't get that many acute TBIs because we don't see them immediately. Okay, but if I have a chance to talk to them, there are certain supplements that they need to take that is going to help heal their gut and their brain. Okay, probiotics, fish oil, and some of the other anti-inflammatory type supplements. So I had a kid that I don't think I saw him one time. He had multiple concussions. He was a college student up in Boulder at the University of Colorado. And we couldn't get him back down. Okay. He was that dysfunctional. So I just put him on a bunch of supplements, and he gradually got better because I had to address the gut dysfunction from the trauma in the brain, and there's a story. I can't remember who it is, a woman who her son had a very bad traumatic brain injury, was in a concussion in a coma for weeks. And she really started working on his gut. And within I don't, a few weeks, he began to come out of the coma and got better. I mean, that's a short story. I don't remember all the details, but yeah, we can't forget that. They're just so integrated. I think if we didn't do anything but work on the gut and did our neural therapy program and Dr. Joan coming in with her craniosacral visceral manipulation or whatever it seemed to be called for, I think we could help half of our patients. Okay. Now, some of them have other problems, but that's why I'm trying to study more and more because there's just so much more to learn, you
Right.
know?
Right. I remember being in school and thinking, I can't wait to get out. I am done. And now I don't have enough time to learn all the things that I want to learn. It's absolutely amazing. So staying on the brain, can we talk a little bit about the vagus nerve? And do you guys do anything like with like limbic system retraining and polyvagal stuff? Do you guys do anything with that?
Joan does. Okay. Now we do have a polyvagal protocol. Tom, my nurse, does most of that. He probably knows more about the details than I do. But yes, we do. We do a lot of parasympathetic retraining.
And what do you
So
mean by that? So you can share with everybody what you mean by that.
it depends on where we put the electrodes.
Mhm.
We frequently put the electrodes on the mastoid process and sometimes in the frontal lobe. Okay. These are electrodes because we're stimulating the brain. And then we use the pulse electromagnetic frequency coils on top of that. Okay. If we're going to be doing that protocol. And that will help retrain and restabilize their autonomic nervous system. And the autonomic nervous system includes the sympathetic and the parasympathetic fibers that are carried by the vagus nerve, which is the longest nerve in the body. It's amazing. And it does lots of stuff.
Yep. The two-way highway that really controls a tremendous amount if it goes awry.
And I think most people, Michael, don't understand how beautifully created we are and how the body is always trying to heal.
Yep.
In homeopathy, we would say your symptoms are just the body's trying to re-establish balance and homeostasis. And even though the symptoms are obnoxious and sometimes troubling, if we don't get back to the core issue of what caused the distended vital energy, that's homeopathy talk. But we're doing the same thing, okay? We're all energy beings, and we're trying to get back and retune and rebalance and bring the whole body back into homeostasis. So,
and we sit in the office, where, it's that perpetual environmental stress, and they are just shoulders up, and they're in that fight flight mode, like just 24/7, and I'll, you do an elimination diet. One of the categories in my elimination diet is shutting off the television, stopping the scroll, stop watching the news, because that information we take in can really do, damage to the gut, to the brain. We had one patient, she did really well on our IBS protocol, and then it was going south. I'm like, what's going on? She's sticking to the regimen properly, and I'm like, where are you when you're eating? Oh, I'm watching the news. I'm like, oh my God, okay. So, once we remove that, everything started to get better again. So I think, getting the brain, I don't think you can treat the gut without the brain. I don't think you can treat the brain without the gut.
that's right.
And both of those involve the immune system, right? So we didn't even touch on the immune system. So
Everything, remember, everything on the functional medicine matrix is connected.
right.
I've been doing, I'm doing this month on GI, on gut health, on my weekly Zoom classes. And, I started last week with just explaining what happens when you want to eat all the way through the body. So this week I'm going to be talking about the lifestyle factors that affect the gut. Okay. And stress, not getting enough sleep, what you're eating, whether or not you're getting any exercise, and how happy you are. That we forget that relationship part. But, when you sit down, eating is a communal type thing. And if you're eating in the car, and I have to confess, I do sometimes eat in the car because I've got so much to do, but it's not the best thing. But eating should be almost a sacred ritual where you sit down, you give thanks for your food, and you eat to the place, so that you can enjoy the taste and the flavor, and you're going to digest your food better. So,
Right.
that's why functional medicine is the best.
I agree. And, we talk about just slowing down the chewing, right? So I use what we call the fork method. And, you take a bite, you swallow, you put your fork down, you swallow your food. Once the food passes the gullet, you then pick up your fork again. By default, you're going to slow down. And when you slow down, you have better digestion. So we talk about that all the time. We talk about, can you eat without anything around you? Can you just sit quietly and eat? No phone, no TV, no radio, no podcast. And saying that to some patients, that almost unnerves them, right? That causes stress. They can't sit for just a few minutes, and they got to look, they got to look, they got to look. And there's nothing ever special that happens. So I agree with you, that slowing down, that giving thanks, that chewing your food, choosing the right foods, all that helps the digestion. So you mentioned a couple of times about PEMF, and I don't think a lot of people know what that is. So could you talk a little bit about that?
Well, it stands for pulsed electromagnetic frequency, a very, very low frequency, a gentle frequency. Okay. And it can be in different waveforms. Okay. I don't want to get too technical, but it stimulates healing. It stimulates healing by increasing blood flow. And there are lots of devices out there. We use very sophisticated high-tech devices, okay? But they're coils that we can put anywhere on the body, okay? We put them on the the head. We can put them on the gut. The only place we don't put anything is right over the heart, because the heart is an electrical organ too. We don't want to disrupt it, but it can promote healing. We have had some absolutely dramatic things happen. Okay, we've had kids with bedwetting, kids with fecal soiling, encopresis. Put the coils on their belly and do a certain protocol, and really eliminate their problem. So it's just fascinating.
Now, when you
And
see kids,
safe.
it's safe, right? And it's safe.
Very
You see kids with, ADD.
Yeah.
Um, I remember when, it was coming about, and it was like, get them off of all food coloring and get them off of, any food dyes, anything that's processed and all that. So what is the latest research behind ADD? There's got to be a nutrition component to it, you would think. Um, what's happening in the brain? What do you see in your clinic with that?
Well, some people think that people with AD, well, I'll just call it ADD. The difference is the H stands for hyperactivity. So you can have ADHD, inattentive, ADHD, hyperactive. Okay. Some people think that there's actually a difference in the brain. Okay. What we see many times is in the left frontal lobe, that they have too much slow wave activity. Okay. So that is going to interfere with their ability to process information and to pay attention. Now, the gut, of course, is going to play a role in that, just as we were talking about. If the gut is inflamed, then the brain possibly could be inflamed too. Okay. So everything matters. Everything is connected, so you can't just treat one thing and ignore everything else. And, there's so many, you can have a kid who is very bright, uh, but just can't stay organized, can't get to school on time almost. So when we do the EEG, we can see the pattern. We see the pattern of slow wave activity in the frontal lobe, okay? And sometimes in different parts of the lobe, but especially the left frontal lobe. So we have to stimulate that area to get it to kind of wake up and get the pathways connecting better. And then we add neurofeedback. Neurofeedback is kind of like the training, locking in the progress you've made. Okay, so we do both.
When you do neurofeedback, is that something that is a weekly thing, something they can take home and work with?
No, yes, it's weekly. The more often they come, the quicker they see results. Now, we don't overstimulate the brain because the brain gets tired. Okay, so once, maybe twice a week for kids to come in, and we start with we call it neural therapy or neuromodulation, neurostimulation. And then when they get to a certain point, we repeat the EEG to see, hey, we've made good progress. Now let's add neurofeedback. Now, neurofeedback is biofeedback. We're feeding back to the person their brainwave signal that has been converted into something like a video, okay? That they're looking at the video, and if their brain is working the way we want it to, they can see the video. If the brain starts kind of getting sluggish, the video will narrow down or dim down. And so that's one of the training mechanisms. Sometimes you can have games. We've done a variety of different kind of neurofeedback protocols, but we do more neurotherapy, it's neuromodulation stimulation right now, because once we've done that, the brain really wakes up and starts functioning better. And then in your everyday activities at school, the kids already paying attention better, having better grades, and actually doing their own neurofeedback training in a way. Okay, this science, the neuroscience, is developing so quickly, and we're learning so much about it. And I'm certainly not an expert in it, but I wanted to bring this modality into our practice because I worked with one of the pioneers in neurofeedback, Dr. Penny Montgomery, many years ago, and I just reached out to her and I said, "Tell me what's new." So that's what we've been doing.
Gotcha. So staying on the thread of neuroscience, and you treat people with the brain issues and gut issues, and we talked about how it goes back and forth. Are there some common supplements that you find that truly support the brain? I mean, one of the questions I'm always asked in the clinic is like, what is that supplement? Prevalence, something like that. They can buy it at CVS.
Prevagen. It's called Prevagen.
Prevagen, like that. And I really haven't seen, like, I'm not wowed by that. Maybe you can maybe you know more than I do on that one, but I'm not really like,
I don't even know what's in it. I think the basics: fish oil,
Yep.
your omega-3s, vitamin D.
Yep.
I check vitamin D on everybody.
As do I.
Your B vitamins are going to be important, and then, magnesium.
Yep.
The basics, that are going to be what everybody should take, even if they never get tested, are probably going to be supportive. And sometimes probiotics. I don't use as many probiotics as I used to. I don't know. I'm learning about it. The microbiome is just, that whole area is just expanding. Okay.
Mm-hmm.
I'm reading a book now called the Brain Gut Axis, and it's just phenomenal.
Who's that by?
Oh God, I knew you were going to ask me. I forgot.
When you think about it, you'll send me the link to it.
Yes, there's several books I'm reading on the gut brain connection, because it's just phenomenal.
Yeah, I agree. I just started a new probiotic called Seed, and they have the prebiotic and the probiotic in one, and it's like it's a capsule inside of a capsule.
Oh, really?
Yeah, it's very interesting, and they've got actually some really good science behind that, and why they're doing what they're doing.
Is C like
SEED?
SEED? Oh, okay.
Yeah. Yeah, it's very interesting. So I try a lot of stuff out on myself quite a bit, before I hand it out and make the recommendation. So take a look at Seed. So in wrapping this up, one of the things I asked you before we got on was if you could think of a case where they came in with a brain issue, you fixed the gut, and then the brain got better, or they came in with a gut issue, you went to the brain and the gut issue got better. Can you think of anything offhand?
I even asked Tom about that the other day, and I couldn't think of a specific person, um, except the kids with ADHD. You know, we had one kid put him on the elimination diet, and because he was bloated and gassy all the time, and he also had ADHD. So he figured out by doing the elimination diet that he could not tolerate dairy. Okay.
Mhm.
So he's good about that. We helped him a lot with his brain issue. And yeah, I couldn't think of anything specific. There may be, we've seen so many patients. It's hard to remember.
Isn't that amazing that you see so many patients that have this brain gut axis highway thing go back and forth, that this is just like a normal practice to you. But when
Yeah.
we step out and we speak to our conventional and traditional brothers and sisters, they're like, they give us the puppy dog, like, what, what? So, it's amazing that you're doing this kind of work. Absolutely wonderful. So, can you talk a little bit how people can, come to your, like the class that you have that you do on Facebook? Like you have like the when you do your talks and stuff?
Yeah, I'd have to. We're trying to figure out. We started it with our patients, okay, but anybody's welcome to come on it's at 4 p.m. Mountain Standard Time every Thursday. I don't know how to get the link to you.
I can get it. We'll get it to you. Somehow we'll get the link from you. We'll have Francis work on that. That's not a
Yeah,
problem. And
because
I'll
what
put
it
that up.
has when you get the invitation, it has like months on there. It's confusing for people, but we scheduled it for every month, every week, and then we also have our functional medicine for everyone Facebook group that I just started. So I'm going to be trying to put lots of good information on that also.
Okay, and you'll send me that one. It's called Functional Medicine for Everyone.
Yeah, with the four functional
Uh,
medicine for everyone. That's that. And then, like we both working with the same people. Our
yeah,
website, we've got all of our videos there. And what else? I have a teachable. What we're doing, I have a teachable membership. So every week we upload the lecture part of our weekly meeting with all the handouts.
wonderful.
It's fee based, but it's pretty inexpensive, and you get everything I've done, you know, forever, I guess, maybe.
That's great. They get an incredible wealth of knowledge for a very small investment that can change your life. So that's absolutely wonderful.
Yeah.
So thank you so much for tonight. I really appreciate our time together. This was excellent. I look forward to doing another one. Right, I'm going to see if we can niche down some topics and then really work it out and share with the patients on how they can change their lives by using functional medicine. So that's great.
Okay, and I'll do it next time, and I won't screw up the StreamYard.
You were fine. No problem. Okay, now hang on 1 second. I'm going to end this and we'll talk in 1 second.